Okay, sorry, did you hit record?
Yes.
Okay, no, it's not. The numbers aren't going. Oh, it is. Okay, I'll cut that out.
Yeah, you're good.
Hi, this is NG placement for OSCE second semester. I'm going to go ahead and do that now. Do you mind putting that side rail up? Hygiene, introduce myself. Hi, my name is Lee. I heard you, I checked your EHR and I see on the record that you need an NG tube placed. Let me go ahead and verify your name and date of birth. Patient states that their name and date of birth, I'm in the right place at the right time to do an NG tube for this patient. So one of the things that I'm going to assess for first is ask you if you have, I'm going to put you in a high Fowler's position. And then I'm going to ask, have you had any facial surgeries, any trauma, broken nose? Are you on any anticoagulants or aspirin at this time? Patient states that they are not, and that they have not had any trauma to the face. I forgot how to put these things down. So we're going to go ahead and test the patency, and can you blow through this side and blow through this side? I think this side is a little bit more open. Are you okay if we use that side? Patient states that they are, so we're going to work on this side. So I'm going to grab some gloves. And the first thing that we need to do is place a towel across the chest. Sometimes when we put these things in, it can get a little messy, so we're just going to do this here to keep you clean. And I'm going to place this here on your lap. Are you okay if I do that? Patient states that they are. We're going to go ahead and measure from the nose to the earlobe down to the xiphoid process, and then we're going to put a piece of tape on there to measure that that's how far we're going in. We're also going to test the integrity of the tube to make sure that it is functioning properly, and we're going to do that over this. Yep. So tube is good, there's no holes or leaks or anything, so we're going to go ahead and lubricate it, which we already have, and this is a spray lubricant for mannequins. Other lubrications would be different for humans. And then we're going to dip this in water to just add more lubrication, as the checklist says so. Then we're going to curl at the end a little bit so that we can make sure that it's going down a little bit easier. And we're going to have a secondary nurse that's going to help me. So I'm just going to have you keep your head normal, and then as soon as we put this, insert it into your nose and we get to a place in your throat, I'm going to have you drink water and tilt your head forward and swallow, and that will help this go down a little bit easier. If at any time you feel uncomfortable and you're it's going to be uncomfortable, but if you feel like you're coughing and it's hard to breathe, then we'll go ahead and stop, and I'll pull it back. Okay, so are you ready? Patient states yes. We're going to go ahead and start to insert. And here we are at the back of the throat. So go ahead and tilt your head forward. Take a drink, and we're going to keep pushing it. And that's as far as the mannequin. Check with your pen light. Will let me go. We're going to check with the pen light, with the tongue. I have a pen light, you can't see it. We would go all the way to the tape, but the mannequin won't let me do that. Thanks, we're done with the water. If patient was coughing, that would mean that we were at the carina, which is approaching the lungs. So I would be able to hear airflow through the end of the tube, and I would pull back, and then I would reinsert, having the patient tilt their head forward again. But we've made it all the way, and we're in the right place, so we're going to temporarily secure it.
Okay, sounds good.
On the nose.
So quickly, as I walk in, I'm going to make sure your bed is locked. Bed is in the lowest position. And
so it's temporarily secured. At this point, do we mark it?
You shouldn't be in here too long.
We're going to mark it with a pin to make sure it doesn't slide out. And while it's in place, I'm going to go ahead and test the pH of the stomach. So I'm going to pull back 5 to 10. 5 to 10 mils.
Things like that. I'm also going to walk in and check your IV if you have some.
everything that I
Oh,
can.
cool, you have one.
And then we're going to
And so
go
I'm
ahead
gonna
and
check
get our
the
pH
size for
stick
smelling,
out
things like that. I'm gonna follow the tube up
and
to
turn the thing. And
the
we'll just
see what kind of
drop
pump is on that, what's the right solution.
1 drop
for
of
Dr.
water,
Do you have any
and we
gauge or
compare
decimals I can know
that
about? Okay.
with our pH, and we see that it's
So,
below a
patient's
6,
appearance and status
so that we
is,
know we're in the
total
stomach.
good.
And then we're going to go ahead and return the gastric contents to the patient.
Your communication level.
And we know we're in the right spot. We'll go ahead and plug this so that there's no leakage.
So what we're going to do, we're going to start
And
off
then
with
we're going to
taking
go
your
ahead
vital
and
signs.
tape it to the side of the face.
You're
And
going to take your blood pressure.
we're going to pretend like we're doing
that.
that. And then I would also get a pin and secure it to their gown right here on their shoulder.
Hold it out and insert it out.
Perfect.
And we're done, right? Do you have any questions? Is that okay? Patient states that it is. So we would go then take them to X-ray and verify that it's in the right placement.
What's your favorite sport? Okay.